Hello, everybody. It's Dr. Rachel Brown, Medical Director of Prevention and Wellness with Business Health Solutions at Prisma Health. I'm here today with your monthly wellness update. I hope you enjoyed last month's update with Dr. Sandra Hardy. She is our Medical Director of Occupational Health and had some great information for you. So check out that video if you have not yet. I'm back this month. We're going to talk a little bit about COVID because I'm still getting some questions around what that looks like and what's happening with the latest variants, the Omicron BA2 variant. So let me start by sharing my screen. We're going to go to the DHEC page, which can give us numbers about South Carolina infections and trends. They're reporting out their data a little differently now. They're doing it weekly, and you'll see that the dashboard has changed. I like to scroll to change this range so that we're looking at about a 1 month period of time, and you'll see that in the last month or so, as this updates, our percent positivity is around 3.6. Now, one thing I do want to throw out there, because 3.6 is a great number, it's below the 5% that we're always shooting for. But we have to take into account that there may be very mild cases of COVID out there that were never tested for. Maybe someone thought it was a cold or allergies or just didn't really want to know what their COVID test was because the disease was so mild. The other thing is that home tests are very available now. You'll never see them out of stock in stores. And so people are home testing a lot. And we don't necessarily know the results of those tests. But overall, cases have been increasing across the entire nation. We saw our first case of Omicron BA2 in South Carolina on March 10th, beginning of March. You can see here that cases have gone up by a third. They're still fairly low though. And the good news, excuse me, is that hospitalizations have not necessarily gone up significantly and deaths have not gone up significantly. So we are seeing a national trend, hospitalizations going up somewhere between 15 and 20%, but things are moving pretty slowly. You can see here the last couple of weeks, a very slow increase to the trend of cases. That's the case nationally as well, although there was a surge in the UK and in other places or other areas of Europe. So we really don't know what to expect. What we do know, though, is we haven't seen that huge spike up and back down like we saw with Omicron BA1, partly due to the immunity that's out there from vaccination and from having had a COVID infection, and partly due maybe to the characteristics of this variant, the BA2. Now, there is a third variant around, Omicron XE. It's actually a combination of BA1, BA2, and the original Omicron strain. Tends to be very mild, less severe, and really hasn't taken off in the same way that Omicron, certainly not the way Omicron BA1 did, or even how Omicron BA2 is doing. So let's move on. I did want to mention that we have numerous areas across the state, Clemson University, University of South Carolina, and USC that are sequencing the viruses, sequencing positive tests out there. And we are seeing a predominance of that Omicron BA2 variant, which is just creeping up ever so slowly there. The good news is that we still see that folks who are vaccinated are much less likely to contract disease from any of the variants. So vaccination and mask wearing for folks who have been exposed or folks who have COVID are still the mainstays of managing the case spread. So I'm going to switch over quickly to our CDC page that goes through the COVID vaccination. Now this page, if you want to stay here, vaccine, stay up to date, it goes through in great detail based on age what you should do to be fully vaccinated, which means you've gotten 2 doses of an mRNA vaccine or 1 dose of the J&J vaccine. And it goes through what it means for you to be up to date, which means boosters. And you will see now that there's additional information around a second booster for folks who are over the age of 50. So let's talk about that for just a second, because I'm getting a lot of questions about that. This recommendation from the CDC is based on two studies. One was from Israel, and it really and it encompasses about 1 million folks over the age of 60 who received this booster. And it was felt that a second booster in folks who are older than 50, and especially in folks who are immunocompromised or are at risk for severe consequences from a COVID infection, have that second booster. However, there's been subsequent data to show that it may not be very long lasting. There's some information out there that shows that there's a peak of that second booster at about 4 weeks, and then in about 8 weeks, there seems to be waning immunity. Now, one thing, I'm going to simplify this for us all. One thing to keep in mind is that when we look at studies that evaluate the levels of antibodies in our blood and use that as a marker of immunity, that's not always going to be entirely accurate, just because our immune systems are complicated and they're very personal. Everyone has a different type of response and different nuances to their immune response. We also know that communities have a very different susceptibility based on levels of vaccination, based on prevalence of disease. So things are going to change within different communities. But when we do see overall case incidences change in folks who have received that second booster, we can kind of take that to heart. So all of that means the jury's really still out. This recommendation is here, but you will find physicians and other clinical folks who are making recommendations to individuals about that second booster, really taking into account what their risk is. So if you are someone who is at high risk for complications from a COVID infection, getting a second booster may be important to you. If you are over the age of 50 and you're healthy, you don't have risk factors, you're in a low incidence area, maybe you don't have a lot of contact or you're not in large groups all the time, maybe a second booster is not right for you. Others are also questioning whether they should get the booster now or wait until fall, when we all are sort of predicting that maybe COVID will become kind of a seasonal, more endemic type virus, like the flu, not like the flu in its mildness, but like the flu in its prevalence. And should I get that second booster closer to the fall? Again, these are all very personal decisions based on talking through these clinical and logistic parameters with your physician. I will say, though, that they are recommending that if you've had COVID, that you wait at least 3 months to get your booster, because the sense is that you're fairly protected with your natural immunity, and the booster's not really going to add anything. So why waste it while you've already got some good immunity? So there's a very vague set of recommendations for you if you've got folks asking about boosters. As always, if you need us to come on site and do vaccine clinics for the primary series to get folks fully vaccinated, or for boosters to get them up to date, we are available to do that for you. Just reach out to us to find out about that. The last thing I want to say about COVID is that a lot of you have been asking about the outpatient therapy for COVID called Paxlovid. The good news is that its availability is also much greater than it was. So you're going to see this more and more out there in the community. And it's been shown to be very effective for outpatient treatment in folks who have mild to moderate disease and no significant risk factors for severe disease, no requirement for oxygen, and so on. The key is that it get prescribed within the first couple of days of the infection, and so encourage your folks who test positive for COVID to visit their primary care physician or an urgent care to find out if Paxlovid is for them, if they are appropriate for that treatment. Think of it kind of like therapy for flu. We got to start it early. It may shorten the duration of the COVID infection, and it may make the symptoms a little less severe. Remember, regardless of outpatient therapy or not, that someone, a team member of yours, an employee of yours that has COVID needs to isolate for 5 days. If they're feeling better, they can return to work on day 6, but they must wear a mask for an additional 5 days. Anyone who's been exposed to that person, if they're vaccinated, can continue to go about their normal routine, but is encouraged to wear a mask and look for symptoms. And then anyone who's not vaccinated is required to wear a mask and, of course, watch for symptoms for 10 days after that exposure. All right, long COVID. We're finding out that now that we've been doing this for a long time and we have a lot of data, about 1 in 4 people develop symptoms of long COVID. And we've talked about that before and how it's really no joke. It's quite a significant impact on quality of life, the fatigue, the mental fogginess, shortness of breath, sometimes rash, sometimes mood disorders could last for a very long time. And we're seeing about 25% of people suffering from this. Turns out if you're vaccinated, only 10% of folks who have a breakthrough infection of COVID, who get COVID despite being vaccinated, will develop long COVID. So even if you think, well, I might get COVID anyway if I get vaccinated, remember it means a much less severe infection, and it significantly decreases your risk of being hospitalized or of death when you're vaccinated. But now we also know it significantly reduces your odds of having long COVID. So take that seriously. I'm going to move on. Actually, I want to show one more resource to you. By the way, if you click on any of the links on this site, they will take you to what to do about boosters, for instance, who should get them, how often they should get them, who should consider not getting them. But then we also have this handy dandy chart, which goes through becoming up to date on your vaccine as well as boosters, but it doesn't have the second booster information on it. So again, if you want to go to see COVID-19 immunization schedules, that's right there, but consider that second booster. I'm going to stop sharing my screen for just a second and talk to you about some of the outcomes of COVID that you may be addressing right now in your workplace. So the first is a good one. And that is that because of COVID, the healthcare providers and systems have learned how to deliver care virtually very effectively. We were sort of tiptoeing into that before the pandemic, and then we all raced to figure out the best way to take care of folks without necessarily having to do that in person. So if you are looking for virtual care solutions for your workforce, either to complement in-person options that they have or to use as a primary source of a connection to a healthcare provider, please reach out to us. We have a lot of different capabilities. We even have something called enhanced visits where we're able to use different technology and equipment to do physical exam components that we wouldn't necessarily be able to do unless we were in person. So please reach out to us if you want to explore those virtual care options, clinics, occupational health issues. We are working on that here at Business Health and want to serve you in that way if that's the most efficient way for you to take care of your workforce. The other outcome that you're probably noticing among your workforce since COVID is a huge increase in mental health issues. Some of them are severe depression, severe anxiety, that we're seeing a lot more PTSD. Others of your workforce may be feeling burnt out. Some may be feeling a sense of languishing or just really not enthusiastic or joyful about what they're doing. And there may be a significant proportion of your workforce that is grieving as well. That may be due to the loss of a loved one. It may be due to the loss of an ideal, loss of a home, loss of income. It could be loss of anything causing that grieving. So we're seeing a tremendously diverse spectrum of mental health and behavioral health issues among all folks. And we have been hearing from you that is important to you as you tend to your workforce and our recovery and continued management of this pandemic and the uncertainty that that's bringing. So we have developed and have had in our back pockets for a while now many mental health and stress coping opportunities for you. So again, please reach out to us. We do things like resilience talks and workshops. This could be for leaders or for your employees. We have a program called MindWell, which is a 6-session over 3 months program where we talk about all of the aspects of emotional well-being, everything from financial wellness to social wellness to physical wellness, and really help with practical tips for your employees, work units, and leaders. And then also we partner with our EAP program, LifeWorks, that we can discuss with you if you're interested and don't have your own EAP program. And then finally, we can come to you and do workforce wellness consultations. Really take a look at your workforce, find out what it is they need, whether that's emotional well-being, physical well-being, team dynamics, and help you to design a wellness program that works for your teams. We are here for you. I'm going to show you how to reach out to us. Let me share my screen one more time. For those of you who've been watching these videos over the last couple of years, you know exactly what I'm going to show you. This is our Creating a Safer and Healthier Workplace page. I'm sorry, I'm having trouble getting to it. And when you go to this page, you can scroll down, watch all of our videos, watch Dr. Hardy's video from last month if you missed it. We have a phone number here that you can call to talk to us about what you need, consultations, MindWell, vaccine clinics, occupational health services, you name it. We want to help you so that you can take care of your workforce. And I will see you in a couple of months. Thanks so much.